Hi guys, welcome back to my channel. It's nice to have you back here. I hope you all enjoyed my last video. Anyways, I hope so. So today we'll be talking about a common vaginal infection known as the vaginal yeast infection or candidiasis, which is caused by a fungus known as the candida, which is characterized by a few symptoms that I'll be discussing later on. Actually, we do have a lot of vaginal infection, but the most common ones are the bacterial vaginosis, trichomoniasis, and the vaginal yeast infection. But today we'll be focusing more on the vaginal yeast infection. The vaginal yeast infection discharge is usually white and thick, resembling a cottage cheese, which can happen to we women at any time. And it's also said that 75% of women will have this infection at least once in a lifetime, and 40 to 45% of women will have multiple cases of this. Anyways, there's nothing to worry about. It can be cleared up easily and quickly if precautions are taken. But the longer this infection stays in our body, the more worsened it becomes, and I'm very sure we all would like that. And it's also important for us to know that normally the vagina contains a balance of yeast and bacteria. This bacteria helps kills germs in the vagina and keeps our vagina healthy. But when something interferes with this balance, it can grow out of control, causing this vaginal yeast infection to occur. So now, the symptoms of this vaginal yeast infection. Number one, it starts with you start itching your vagina, swellness or soreness around the vagina, redness, rash your vagina, and you at times you have this odor and increased amount of discharge in your vagina. So as we all know, there's always a cause of something. So it's better for us to know the causes of this vaginal infection, so we can be able to prevent them. So number one, the unnecessary use of antibiotics. When you unnecessarily use antibiotics, it decreases the amount of lactobacillus, which is the good bacteria in the vagina. Hormonal imbalance, especially during menstruation, pregnancy, or at the stage of menopause. Poor eating habits, especially when you take unhealthy sugary food, uncontrolled diabetes, lack of sleep, and stress can also cause this. And having a weak immune system will also cause vaginal yeast infection. Actually, the diagnosis of vaginal yeast infection, most time the gynecologist asks about your medical history and symptoms, and the doctor can also confirm the diagnosis by performing a pelvic examination. Now to the prevention. How to prevent this vaginal yeast infection? You should always avoid wearing tight pants, leggings, pantyhose, and the likes. We should avoid using feminine products and scented sanitary pads. We should avoid frequent use of hot baths. We should also avoid dutching and unnecessary use of antibiotics. You can only use antibiotics only when prescribed by your doctor, and you shouldn't use it more than the time the doctor asks you to use this antibiotics. And also avoid sitting with wet clothes, especially bathing suits. So what we should ensure, keeping our vagina clean, eating a well balanced food, taking supplements, washing our underwear frequently with hot water, and we should try and change our underwears frequently also. And we should wear natural or loose fibers such as cotton or silk. You can also take up supplements with lactobacillus and silk. So now I'll be telling us some treatments for vaginal yeast infection. Taking of an antifungal medication for 3 to 7 days actually clears up vaginal yeast infection. We have these antifungal medications in cream, ointment, tablets, and suppositories, but which could be prescribed or over the counter. So I'm going to be listing few medications. The medications, we have the common medications, which include Terazole, Monistat, Mycatin, Lotrimine, and the Genazole. These drugs are in the same antifungal group, which they actually have the same work by breaking the cell wall of the candida. At times, we are also giving this oral prescription known as the diflucan, which is always prescribed in a single dose. But when you have a severe condition of this, it might be required to use 2 doses in 3 days apart. And there are also some natural home remedies for this vaginal yeast infection. Actually, these home remedies are not clinical, they don't have any clinical backup, but some people have used it. I'm not going to say it's not reliable, because it's not as reliable as this medication. It's important for us to know these natural and home remedies, which includes coconut oil, tea tree oil cream, garlic, plain yogurt, and boric acid vaginal suppositories. And we should also ensure that our hands are clean before we apply these vaginal creams. It's important to ensure our hands are very clean also. So thank you guys, and don't forget to like and hit the subscribe button. Thanks for watching. Bye.